Welcome back. The Jacksonville dental specialists have been in Northeast Florida in the community for years.
That's right, and they say that they have been supporting Jacksonville residents with simplified yet safe solutions for complex dental issues. Prosthodontist Dr. Matthew Naraki from the Jacksonville Dental Specialists is here today to help us to understand how to make the right choice between a dental implant and a bridge. Thank you so much for being here, because technology is constantly evolving in your industry.
It is, and a lot of what my partner and I talk about, Dr. Ega, is, big full mouth stuff, but a lot of our patients, their tooth is missing or it's broken, and the question is, well, how do I, replace it? It's not necessarily every tooth, although that can be done. It's when one or two teeth needs to be replaced, the question, dilemma is oftentimes, well, how do I do that? Do I do a dental implant? Do I do a fixed bridge? Is it a combination? And so it's never really a right or wrong answer. A lot of what we do is not right or wrong, it's differing for different situations, and so helping patients understand the pros and cons is worthwhile, because there are clear advantages and disadvantages of a bridge versus an implant, and it really is what's most appropriate for you, what's going to help you satisfy your goals and your wishes, and how can it be done in maybe in a cost-effective manner. And so the thing about an implant to remember is it's actually attempting to recreate, although man-made, recreate missing anatomy. It's the closest thing that we've got in dentistry to replacing the missing tooth, the missing anatomy. And when you're replacing one tooth, you can avoid bridges. And so what's the difference there? Well, an implant in and of itself is a post, or it's a screw. It's put into the bone, and it fuses with the bone through a process called osseointegration, and that typically takes a couple months, anywhere from 3 to 6 months. Different ballgame if you're doing the full mouth, but a single tooth, it takes about 3 or so months, and then you put the tooth on it, or if you're missing several teeth, we put the couple teeth on it. Whereas a bridge relies on preparing the adjacent teeth and then making a permanent bridge that cements on it, but everything's connected. And so the question is, well, what should I do, Doc? What do you recommend? And it depends. So there's some clear advantages. With an implant, it's easier to keep clean. It's easier to floss. You can floss in between them. It's recreating that.
But that's permanent.
It is permanent.
Okay.
It is permanent. It also has the benefit of helping preserve the bone. You're not going to lose more bone. When you lose a tooth, you're going to lose the bone. Your bone is purposed just to support a tooth or an implant, so it helps maintain bone.
Because it's in the bone.
It's in the bone.
Connected it to the bone.
Exactly. It's providing purpose to that. It's putting the forces. It's like working your muscles out. It's creating purpose there. It's the closest thing we have to recreating anatomy, missing tooth structure, missing bone and gum structure. So it's recreating that. It has the advantage of it can't get a cavity. It's not prone to that. The #1 reason why bridges on teeth break down or are replaced is due to cavities. And there's some studies that indicate every 5 to 7, up to 10 years or so, that starts to happen. So you can avoid that. There's situations where an implant's more aesthetic. Whereas on the flip side, the bridge, the advantages of that are it's oftentimes quicker treatment than the implant, a couple weeks versus several months or more. The upfront costs are oftentimes less expensive, but there's an asterisk by that. As time goes on, if the bridge has to be redone, the cost now starts to go up. But the upfront cost initially is less expensive. There are indications where it might be the more aesthetic option. So it's important that you understand that there's pros and cons. It's not right or wrong. Oftentimes an implant is the far superior result. It's kind of becoming the standard of care, but that's a conversation that you should have. And that's really where our practice, being a multi-specialty practice, we can go through both those options. We have a lot of patients that we do implants on, but there are indications where we still do big fixed bridges that have been around for 100+ years, and they work very well in the right application. So understanding, being informed, making an informed decision is the best way for you to make that decision.
And one way that people at home can do that is attending one of your seminars.
So a wonderful thing that we do is every month we do a free educational seminar on tooth replacement options, where we talk about one tooth or several teeth, or maybe you're missing all your teeth. Our next one is Wednesday, October 18th at 6:30 p.m. Seating is limited and it fills up quick, so please call and speak with Lydia or one of the other ladies, or if you want to come to a consultation, you can, but that's where we'll go over kind of the initial information to help you out.
And is that when you're sitting all together, do people ask you questions then, or can they come up and they're embarrassed to ask you a question they can ask you later?
There are some people who have no problems, with whatever that has to do with it. Yeah, here you go, this is my situation, that's fine. There's other people who they want to hear the information, they don't want to share that in a public setting, and that's fine too. And ultimately, we need to sit down at a more thorough consultation. So for those people who pose the question, because probably someone else has the same one, we talk about that, or you can come up to us afterwards and talk on a more one-on-one intimate level. And then ultimately, ultimately we need to get you to a individualized consultation for your unique situation. But it's very comfortable, it's relaxed, it's not, you know, there's beverages and food and stuff there, so it's fun, it's informative.
And we get to see you.
Exactly.
So thank you again for coming by. It's
you.
always good to see you, and we'd like to thank Jacksonville Dental Specialists for sponsoring this segment. Give them a call at 904-460-4201 today to schedule a consultation, or you can visit their website to learn more. It's jacksonvilledentalspecialist.com.